Hey folks, Ann Suazo from Total Health Physical Therapy in Herndon, Virginia. I'm here to talk to you today about brain fog. We've had a lot of feedback from our patients and viewers saying that since the quarantine started, they've just feeling like they have brain fog and a lack of mental clarity. Most likely this is due from all the stress of the COVID-19 and the heightened emotions. So I wanted to give you some techniques to help with that. First of all, it's important to understand that our body stores emotions in our organs. For instance, when you're feeling worried or concerned, you might feel like you have a stomach ache or your gut is in knots. And this is because your gut is your area for worry and concern. Previously in my other videos, I had talked about how the adrenal glands process stress. And we've talked about anxiety and how those emotions are stored in the right kidney adrenal complex. Today, we're also going to talk about your lungs, which process grief and loss, and about your liver, which processes your anger. So if you can tease out which of these emotions is affecting your brain fog or lack of mental clarity, then that's what you want to process. You can process any or all of these emotions. It's just important to really process them as thoroughly as possible. So my suggestion is, as I said in my previous videos, what you want to do is get a pencil and paper. Watch this video a few times so you can get really familiar with the process points. And then find yourself a space, a nice quiet space for about 15-20 minutes where you can go ahead and do your processing. So for starters, we want to use the frontal lobe, which is right here on your forehead. This is your area for memory and judgment. This is going to be really important when processing these feelings of brain fog and lack of mental clarity. So the first technique is just a really good shotgun technique. You can take your frontals to the ureters. The ureters are in your lower back. They are little straw-like tubes that go from the kidneys to the bladder, and they facilitate drainage. And this is a great place to start. And our focus throughout when we are using the frontal lobe, is to really trying to go deep and really to feel deep into our forehead and get a connection between those two hands. This should also feel very, very relaxing to you. You'll do that for 10 to 15 minutes, always taking some deep breaths, focusing on the connection. Then, as far as the emotions, we're going to take the frontals to our adrenal glands, which is in that lower rib cage, just above the kidneys. This is if you're feeling like stress is really contributing to your brain fog and lack of mental clarity. Always focusing on that hand and taking the other hand to the frontals. Next, if you feel like anxiety is really what your problem is, you can just have your hand on that right kidney adrenal complex and you'll process that. Again, focusing on that connection, going deep into your forehead is your primary hand, is the frontal lobe. And again, holding this anywhere from 10 to 20 minutes. If you feel like you're having a lot of anger, then you want to take your hand to that right lower rib cage where your liver is. If you're feeling a lot of grief and loss, as so many people are, you want to put your hand on your chest, really open it as big as you can, and really think about getting as much lung tissue as you can. You can also go to the sides of the rib cage to get lung tissue. Always taking deep breaths, focusing on the connection, especially that hand on your forehead, accessing the frontals and going deep. Once you've taken the frontals to these different emotional process centers, then we can move on to drainage. From there, what we're going to do is we're going to take our hand on our lower back, and that's going to stay at the ureters. And again, now this is really focusing on the drainage. We can start with the lungs for processing grief and loss. We can drain our liver to help drain out some of those feelings of anger. we can go to our adrenals. This is very common, taking the adrenals to the ureters to drain out those feelings of stress. And finally, our anxiety, that right kidney adrenal process center. Again, it's best to focus on one area and really drain it thoroughly or process it thoroughly and then move on. So this is not a race. Take your time, and I hope this really helps and everybody stays safe and enjoy.